senior nutritionist, is also here with us for any questions you might have regarding the home visitation program, and also Claudia Oyoa from Northeast Valley WIC is here. So as we go through this, bring your questions, okay? I'll be happy to start now. So very excited to present information on the California WIC card. I am going to present a quick overview of the WIC program. And I apologize to those who might be very familiar with WIC, but I still wanted to give you a quick overview for those who might not be. WIC is a special supplemental nutrition program for women, infants, and children. And so WIC is a federally funded special supplemental program. It started 45 years ago, back in 1974. And in California, Department of Public Health oversees the program. PHFE is just one of the several sister agencies that service participants in Southern California. And we're very happy to have also Northeast Valley here with us today. And some of the, the four core services that WIC provides is breastfeeding services and support, nutrition education, healthy food, and family resources. In terms of breastfeeding services and support, I am going to speak for PHFE WIC. If you have any specific questions about some of the other programs, I will be happy to direct them to those specific programs because there might be a slight variation of what we do. So we provide breastfeeding education, electric pumps, breastfeeding support, lactation consultants on site that do home visitations also. In terms of nutrition education, this is provided in groups at the WIC offices, individually one-to-one, as people might need certain, they might need to have some nutritionally related issues addressed with them. So we have RDs at the WIC sites. We have part of professionals that are highly trained also to do this. And then we have our online education. For healthy foods, food benefits are issued monthly to all the people who qualify to receive the benefits. And WIC provides important nutrients that are critical during certain periods of growth, such as pregnancy and from birth up to age 5. So for family resources, we have additional services in the community where we can provide some support to families. In our PHFE WIC offices, we also have some on-site support from Call Fresh, Medi-Cal, Head Start, dental services, and so on. So if you are interested in knowing more about it, we'll be happy to also direct that to specific programs and give you more detailed information on what they might offer, since I'm speaking for many WIC programs here. Who qualifies for WIC? So for WIC, it's category eligible, so basically women who are pregnant, postpartum breastfeeding, if they continue breastfeeding their baby up to the first birthday. For women who just had a baby or lost a baby or terminated pregnancy, they also qualify for 6 months to receive the WIC benefits. And I believe some people might not know this. I don't think we had widely spread this information. So I would like to highlight that if you have a mom who might have lost a baby or decided to terminate a pregnancy also, they do qualify for 6 months of benefits. The infants, they qualified up to the 1st birthday, children up to the 5th birthday. Foster children qualify for WIC services. Fathers may apply for WIC, and we have now couples, many couples that are applying also for services. It could be to moms to dads, and we welcome them. So let me continue. So for eligibility for WIC, basically, like I mentioned, they need to be in one of those categories. They need to be income eligible. They need to live in an area where WIC has an office. If they come to one of our offices and it's another geographic area, we'll be happy to direct them to a WIC office near them. Have a nutritional risk also is one of the requirements, and I mention this because sometimes we have children who have anemia. So that is definitely a requirement. It might be a baby that has a failure to thrive, and definitely a requirement. So if we have healthy children, which is always ideal, we could definitely find nutritional risks when we assess their diet at the WIC office, and that will make them eligible. So continuing with the eligibility guidelines, we say that families, we are mandated by regulations and federal regulations that income must be under 185% of the poverty level. However, families with adjunctive medical can qualify for WIC. For foster children, we evaluate their income individually. And one thing I wanted to really highlight is that immigration status is not considered when we are determining eligibility for potential participants. And we're really happy to share that with the new ruling of the public charge determination, WIC was excluded from being part of public charge. So please help us spread the word about that. So now I'm going to pass this to Samar McGregor, who's going to talk about the successes of WIC.
Hello, everybody, and thank you for joining us today. So we talked about WIC and how great the WIC program is, and we all know that WIC is great. But we need the studies to support us and to show and showcase why WIC is so wonderful and important for the health and well-being of our families and communities. So I'm going to highlight a few studies that have been recently published about the WIC program, and those are available on our website, and you can see it on the bottom right-hand corner, and you can go under research and evaluation, and you can find these studies. So the first one that I wanted to highlight, and this came out just a few months ago, which showed, and this is a repeat of a study that was done in 1970, something about when we used to say that spending $1 on WIC or on WIC resulted in $3 of savings in healthcare. And now it's showing that it's resulting in a mean savings of $2.48 in healthcare. So that's still big. That really shows when we're talking to legislators about WIC and why it is still important to fund the WIC program. The next study that I wanted to highlight is how WIC has impacted the declining rate of obesity in preschoolers, and that's also highlighted because as Pina will talk about the food package, and some of you may know about Pina mentioned the benefits, and we call them food package and soon to be benefits because we're going EWIC and EBT. But the foods that we provide on the WIC program are scientifically based, and the what used to be the Institute of Medicine, which is now the, oh gosh, I cannot think of it right now, but the National Academy of Science, Engineering, and Medicine did the study about 10 years ago. We're due for changes in the food package or in the food benefits, but at this point, it's not going to be, due to several reasons, the USDA is not going to embark on that. But there is a reason why the food benefits are so important. As some of you may know, we offer foods that are rich in protein, iron, vitamin C, whole grains. And so that plays a big difference. We give still a bit of juice that I know that the AAP, the American Academy of Pediatrics, does not really support us on, but we've gotten better. We don't give as much juice. And we give our nutrition counseling on that based on the fact that we'd rather offer the children water or milk rather than just giving them juice. But anyway, the study shows that there is a decline in obesity rate for preschoolers. The other thing I wanted to highlight is our Los Angeles WIC data. This is in collaboration with First 5 LA. We got funding to do the data mining, and so that's available also on our website. But it also shows you can get data, and this is for all LA County data because it is it encompasses all 7 local agencies in LA County, the data from 7 local WIC agencies. And it shows that currently there's a 20% of 3-year-olds are obese versus 22% of 4-year-olds, but also that shows a decline as well. So there is a lot of data for the LA County WIC data, not just for obesity, but a whole bunch of data that you can have access to on our website. Another study that is the Center of Budget and Policy Priorities is always publishing articles about the WIC program, and that is a historical data that is historical data about how participating in WIC as a prenatal for the prenatal our prenatal population, it improves in birth weight and it reduces the risk of adverse birth outcomes. We do a lot of education with our moms about signs of premature birth and making sure that they go for their prenatal checkup. The food that we provide is healthy foods, and we monitor them constantly when they are pregnant. So and it shows, everything that we do is showing in those studies. And we've been in existence for about 45 years now, and we have really impacted the health and well-being of our families.
Okay, so I am back here. So basically, we have very easy ways to apply for WIC. And like Samar said, I just really want to also illustrate this again. If you want the WIC data from data mining, you can find a link from our PHFE for our website. So if you would like to look into more data of what we've done for the last, I don't know how long we had it, but the last 15 years or so. So there's a lot of wonderful information that can be, assessed or utilized if you need to. And then we also have to apply for WIC, they can apply at our website. We have an area which says apply, and it's apply button that we call it. People can leave their information there, and somebody will call them back to ensure that they come to the WIC program with instructions on how to. But they can also call a regular line. And again, we have the text apply. If they text us also, somebody also will respond to them and initiate the process to get them into the program. I want to also just mention, if you have any questions and you want to type your message, we'll be happy to take them. We have someone that can support us here collecting those, or it can happen at the end. Either way is fine, but I just wanted to mention that. So we are really excited now to present the California WIC card, and it actually looks like that card that you see in the middle. It's very colorful, it's very appealing for fruits and vegetables, and we're so happy to say goodbye paper checks that we had for 45 years, and hello, the WIC card. One thing I want to mention is in Southern California, since I understand that many of you are working in different areas, the program is going to implement the card. The state is going to implement the card in 3 waves. So we are coming up with the first wave in Southern California. November 11th is our first day, and then December 9th would be our second wave, and January 21st will be the third wave. So that's how it's going to happen. Just to paint a little bit of the picture of what areas, the wave 5 is South Bay area, kind of Orange County areas. That's our wave 5, and then it moves up geographically to LA and going up, including the Valley. Probably you guys will be at the end. San Fernando Valley on January 21st. So would participants be able to go get a WIC card to a different WIC site or program? It's sad to say, but no, they have to wait until it comes to their area, their location, because of the record transferring and everything. So they must just, I consider that good information for you to know. just in case. So we basically, what we're doing is we're transferring records of the current participants that are coming to WIC and the areas that are going live. And the stores too, the same thing also with the stores. So just to illustrate that.
They can take either though.
Yeah. So for the California WIC card, we're really happy to say that it's going to be an easy shopping experience. They won't have to show no more paper checks of the WIC folders, which were long WIC folders that they have to present at the stores, and they were comparing signatures, no more signatures to compare. If a participant loses the card, the benefits can be replaced. That would be not a problem. It can be used as a debit card with a 4-digit PIN, and which it makes it secure. Unless they give that PIN to someone, no one can use their card, and it gets invalidated after X number of attempts. So it's totally like a debit card that is secure. They can buy food quantities as needed, unlike in the past, if we had a check where the check was specific for 2 pounds of cheese and 2,000 eggs. They had to buy the whole quantity at once. And we are so excited and happy for those families that have issues with either sharing a house or an apartment at home with another families, and they're sharing also a space in the refrigerator so they could go buy as they need, which is really great. We have the WIC app to assist with the shopping and with appointment reminders. So I'm going to show you next what a receipt will be when they go to the store. We're really excited about this because it's very easy. Our families sometimes will have a hard time understanding what to buy with the checks. So when they go and buy their food, they can, the receipt would list what they bought, how much they paid, if there was any discount, because things that are discounted also should apply to WIC, or if they bring coupons. And then it has their total purchase. It tells them what the benefits expire, which is really good, it's in the receipt, and what benefits still remain on their card. So you can see clearly in the receipt that they have all this information in that receipt. So somebody asked, what if they lose this receipt? Can they find out what is left? And yeah, definitely. I'll talk about that in the next few slides. So the WIC app, that is just the face of the WIC app. It has appointment reminders, so people will get appointment reminders. Our new system is very much appointment-based. So we were really trying to get people to come to their appointment time. Although for those that are unable to, we have slots that we have assigned to them, but it will be preferable if they came on their appointment time because they can be served faster than if they show up. We might not have an immediate appointment available within the next hour, so they might have to wait 2 or 3 hours. We're hoping that it wouldn't get to that, but we have done a really good job, I think, in the last 6 months as programs informing people how to prepare and about their appointments and so forth. The app also has the UPC scanning. They can check what foods they can get. I think it's nothing more embarrassing than being at the checkout counter and then being told, this is not allowed, or you cannot buy this food with your WIC checks. I had witnessed that many times, and I'm so happy that we have this feature because it's really going to take that stigma that I am using a public benefit. 1, I have a card that looks like a debit card. 2, I already know what I need to buy, and I can select the right food. The app also has the WIC office locations, and they have what stores they can go shop for their benefits. You will see that normally when I'm presenting for an audience and I'm in front of them, I can show that app on my phone. But what I did is I put a couple of slides just to give you a little preview of what the card has. So it has the WIC locations. I am where the blue dot is, and all the red pins show what a WIC location is near me. When they click on the pin, it shows an address of that location. So it's really simple, and it shows them within 60 miles? What do they have near them? And it's not exclusive to a program. It's just all the different WIC programs will be listed in this in the app, which I think is really great. For food balances, we talk about if they lost a receipt, they can check food balance in the app, and it will tell them what they still had left in the cart to buy. So we're making it a lot easier and going really with the times now, right? So how do you connect people to us? Again, our website. They can send a text message. They can call us. We are also in social media. We're in Facebook, Instagram, and Twitter. And in social media, we have several languages. We have Vietnamese, Arabic, we have Korean, and Chinese. So we are also present in those 4 languages, and that are very, very popular. So if you have other ethnic groups that would like to know more about WIC and what's happening, you can also direct them to the social media. So it's almost here. We're so excited because by next week, our first wave of centers, will be on already on the new card on the 11th. So please send your clients to come now. One of the things that are important is that it will be a lot easier for participants to have all the information up to date. So if they come to see us before those days, it will be great. However, I gotta say this, if they come in November, they will not be able to get in November their WIC card. They will have to wait until December, but their information will be up to date. So anyway, we welcome them either, this month or next month. The one thing I wanted to mention is that some families have stopped participating in WIC. We think there are different issues, different reasons why people stop participating. It could be from the stigma of using paper checks at the store. Sometimes people looking at them. Sometimes it could be related to immigration. We have heard just so many different things, and we are hoping that at least with the card, we solve some of those issues. So we want them to get the WIC benefits. Please refer them to WIC. One of the things I would ask them if they are on WIC, and if they said yes, ask them when was the last time they cashed checks. If they said, oh, it's been a while, or it was like a few months ago, that means they consider themselves being on WIC, but they haven't been to a WIC office. So they deserve to be on WIC. Their kids deserve to be on WIC. And I really just ask them to have them come to WIC, get the WIC card. We welcome them at our WIC offices. I mentioned the different ways how they could come and get the WIC card. So now I'm going to leave it for questions, unless Sharon has anything to add in terms of her home visiting program.
Good morning, everyone. I want to also invite you to ask any questions that you have for us. We're real excited about this new rollout in terms of the cards. We've worked closely with some of the home visitation programs. I think our experience with some of the Welcome Baby, outlets is, could be improved. And so I think this is the first step in that. And so we're hoping to, take it from here and let us know how we can pick up from there in terms of the referral process.
Okay, I believe that concludes our presentation.
I mean, maybe we're on mute. Steve, are you there?
No, we're not on mute.
Are the attendees on mute, though?
Yes, everybody is actually muted. So if anyone has a question that they would like to ask over the phone or make a comment over the phone, you can use the hand raising function and I'll unmute you. I mean, unfortunately, when we unmute everybody, it seems there's always feedback and background noise. Sometimes it puts us on hold and we hear the hospital's elevator music or whatever. So we do have everyone muted. But if anyone would like to make a comment or ask a question to Pina or Sharon, any of our WIC representatives about the card or the app, initially, if we could just get the questions on that, just raise your hand, and if you don't see that, I think it's the bottom little button on your left side the right side of the screen, sort of the top right in the webinar, there's a little hand there. You can just raise that and I will unmute you. And I don't see any hands raised. Anybody have anything about that? It was a very thorough presentation, but there must be one question or two.
One thing I do want to mention, if anybody would be interested that we come to a specific group or a hospital or, other audience that might not be here and they would like us to come and present, we'll be happy to do that too. So just to put that out there.
Great.
And I really want to thank everybody for,
And then, Steve, can I make this announcement too? I think that while we have tried really hard to make our participants aware of this card, there's a lot of people who don't know. I mean, when we're out in the community and things like that, we can't assume that they know that this is coming, and so there wasn't any big campaign or anything where that got highlighted. Yeah. So we really appreciate anything you can do to help us with getting the word out, because it's got to be by word of mouth. And that's where we are with that.
Yeah, absolutely. I agree with that, and we really thank you for listening to this information and helping us spread the word and pass it on to more people, because that would be probably the only way how they might get the information. Like you said, unfortunately, the state did not do a campaign on this, so we're trying to do that first with community partners and pass this information to more people other than also our WIC site.
Great, yeah, definitely.
And if anybody
sorry, go ahead.
Sorry. If anybody's interested also in getting more handouts and more information, please also let us know. We'll be happy to produce more information, more material.
Yeah, we will send around. I know, Pina, you shared the flyer with me and the other handout, and those two, as I said at the beginning of the call, are posted in the webinar there. If anybody wanted to just click on those, you can get them now, but I will send those around in a follow-up email. And if there are other WIC materials that you'd like me to send, Pina, we can do that as well. As I mentioned, this is being recorded, so we will post the webinar recording. And I encourage everybody who's on the call to bring it back to your agencies or hospitals and make sure that the home visiting staff knows about the rollout of the WIC card and app as well. I have a quick question. When it comes to families getting the card, actually going to a WIC office and getting a card, do they make a special appointment for that, or what's the best way to do that so you're not swamped with? I imagine it's going to take some extra time to issue the cards.
Giving us a phone call will be great, because our phone department has the capability also of working with some appointments and giving the person, even though she didn't have an appointment, she might be able to get an appointment before she goes in. But if they're unable to and they walk in, they might just have to wait a little bit longer. Texting us also is a good way, especially if they have been on WIC. They can text us and we can arrange also that part. So we're really trying to help everybody. If this is going to be a transition, because we're not only just having a new card, our whole system, how WIC operates, is changing. So it's a whole new computer-based program, and we're converting the files, but as the person walks in, we have to update quite a bit of information. So the first time might take a little longer, but we will be more efficient as time progresses and we provide the services. But we welcome anybody to call us, text us, go into the website if they want to apply. we have people in all the different areas assisting them.
And I wanted to add, Steve, one other thing is like, I think a lot of families, especially may you know, maybe not be getting, let's say, whole foods. And there certainly, when you look out on the ground, and a lot of us are on the ground, your people and us as well, and we see the people that walk in, and we can see that people are having a hard time. There's a lot of difficulties families are having, and certainly we want to meet them in terms of gaps, in terms of need, and I really think we need more like in the home visitation program. That's what makes you guys such an ideal partner, because sometimes they're not taking advantage of the resources they could be. And we certainly have a lot of the communities that we're seeing. We see that we have a lot more people that qualify for our program that don't participate, and that's an easy resource that they could. And so that's why we're really taking the time to really kind of emphasize some of these things, because they'll tell you sometimes, I use WIC before, but they haven't been in several months and haven't taken advantage of it. That's what we're seeing.
And adding to that, the fact that they trust your program very much, they're allowing you into their house, it makes a huge difference when you remind them, when you tell them. You know, I think people do listen to people that they trust, and they will feel more comfortable. It will ease off a little bit of that anxiety of participating in programs, especially when it comes to immigration. I'll be happy to send you a flyer so we can share with the audience about WIC not being included in the final ruling of what programs make a public charge. They can share this with them, and it will never affect them participating in the program as the ruling is stated, unless that changes in the future, but we're hoping that wouldn't happen necessarily. But where we are right now, we are a safe program to use, and I will send that, and I encourage you to talk to families about that, since you see the families in your home visitation program. So, and we thank you for supporting WIC with that.
Great. Yeah, I wanted to ask also if I guess we could move on now beyond the card if there are no further questions. If there are other questions about the card or the app and you don't want to do that by phone, you can feel free, of course, to type in the chat box, and we'll address those. But I guess we could kind of shift a bit to discussion of outreach and how we can work together, how Welcome Baby and the partner home visiting programs, Healthy Families America and Parents and Teachers can work with WIC to kind of advance and communicate what you feel is important, how we can help you, and then how we can also get more referrals to home visiting programs from WIC offices. As you said, I think it's a perfect partnership because we're in homes and we can communicate with families. I think, you know, obviously a very trusted partner in all the home visiting staff with families. And of course, you have an interest in getting those clients as well, which is where WIC referrals come in. So I initially had created a poll, and it doesn't show up for some reason, but all I wanted to ask of everyone on the call who does outreach work was simply, do you feel that there is the potential to increase referrals from WIC clinics to Welcome Baby? And if everyone could type in a yes or no, or any added comments in the chat box, if you feel that we could do more to increase prenatal referrals to the Welcome Baby program, or if you feel like I've got that covered and I don't feel that there's any room for improvement, you can type no, and that's fine too. No right or wrong answer. So I see a few yeses. Looks like the yays have it so far.
And I want to also tell you a little bit of how our outreach happens. So we have 10 people who conduct outreach geographically. So we separating by geographic area. And then they in turn visit all the different resources in that area. I think we can partner the people from your programs who do the home visitations and our people. I'm speaking for PHFE, but I'll let Claudia also maybe let us know how Northeast Valley can do that. In terms of our area and PHFE WIC, it will be ideal to connect our outreach specialist, who is the person who works very close with the centers, the WIC offices, as well as the community. When we partner these two people, we can come up with ways of cross-referral. You know, I think if they talk to each other, they share the efforts that both of them are doing. They share information, and we do a mutual referral directly. So let's say that you have person X in this area, East LA, and we have our outreach specialist in that area. If those two are working, coordinating efforts, our person, our WIC person, can definitely ensure that we are connecting the person to all the supervisors in the areas that she oversees for outreach efforts, that we remind and that we continuously address the referrals to your program, and then vice versa. Your person assigned, let's say, to that area, and I'm not so sure if you do it geographically, but I'm assuming you probably would, then that person, as they do the home visitations, as they see people, and they continue, I'm thinking now we can develop questionnaires, simple questions that we don't have to develop it. In fact, we have it. We use it to train our center staff to assess participation from people that we come across, because most of the time they might say, I am on WIC. So we go through other few more questions to truly assess if they are receiving WIC or not. So I think if we connect our outreach specialists with your outreach people, and they both share by the geographic area resources and referrals, I think we can have a closer understanding of both programs and how we can mutually benefit from cross-referring.
Wonderful. I think that sounds fantastic. To actually make this happen, could you maybe assemble a list of all of the WIC outreach folks or anybody who could take part in this, and you can send it to me, and I will connect the Welcome Baby outreach specialists with them by region. Does that sound like a plan?
Yeah. That sounds great, because then by region, we can also give it to the other WIC programs, and Claudia is saying yes for Northeast Valley. One of the things I want to tell you about us is that our outreach department, the 10 people who do 100% outreach efforts, they meet here twice a month. It might be good to really hear from someone, an overview, and I will be happy to invite other programs. So we all do WIC programs here, an overview of your Welcome Baby program, your home visitation, and then we can mutually benefit. I would love to attend that, so then I can look into other ideas of how we can mutually develop further partnership.
Perfect.
I don't want to. I think one of the things I have to bring up, because I'm on the consortium, I'm part of the home visitation consortium with Lynn Kersey and MCH Access is who I mainly see. Jan French is, of course, heavily involved in the consortium. I'm sure that some of the folks here on this call also attend those meetings. But I think when we talk home visitation, Welcome Baby has certainly been a great partner, but I think that we also have to sometimes put it in the context of all the other home visitation programs as well. And, you know, with the expansion, we just have to put it in context. So anything you can do to help us with that, and I know that you guys are all collaborating and you're working together with these other programs as well, that really helps us. Because in the end, we don't really care who it is that helps our families, but we just, they get helped. But they get helped. But, you know, but it also is, we only have the families we have, and so, you know, the difficulty we have sometimes is putting in how to coordinate this, because someone may say, oh, WIC isn't referring to us, but we are referring to home visitation programs. But, you know, this isn't all we have to do in the whole day when we have the short window of time we have with our clients in terms of referrals. Does that make sense?
Sure. Yeah, absolutely. That makes sense. And I think, as you know, Welcome Baby
so just in context.
Right. Welcome Baby is its own program, but it's also kind of the gateway to the Healthy Families America and Parents as Teachers programs.
Yeah.
And now with the expansion, they can also accept prenatal clients. But we're still pushing to get prenatal enrollments in the Best Start areas, the first 5 LA's designated Best Start communities. But Welcome Baby outreach specialists know the drill, and they know and are referring to the DPH expansion programs when those clients are outside of the Best Start communities or not delivering at one of the participating Welcome Baby hospitals. So, I mean, I think Welcome Baby is still really a great gateway, a great entry point in any case for these other programs as well. But yeah, I take your point. It's a good point. It's not just about Welcome Baby, but that's really what this call kind of is focused mostly on.
Right.
Is our partner in Welcome Baby, not so much say Early Head Start or Nurse Family Partnership, although Welcome Baby refers to Nurse Family Partnership as well. So again, we
as an outsider though, as an outsider, Steve, I think what it is that sometimes the people on the ground, they don't have those larger, big picture conversations. So it looks like maybe there's more of a competition for the client when all we're saying is you're a great program, but it's like, how do we do this and so that everybody, we meet the needs of everyone. Does that make sense? In the
Absolutely, yeah.
Okay. So if your people can help us with that, that would really be good, because we've been approached by all these different programs. So that's why we tried to collaborate with the MSP helping us with getting to these other programs. So if you can help us with that and putting this in context, and maybe this can happen offline, outside of this, Steve, I'm happy to help with this, because we really, me and Pina definitely are having a sidebar on this. Yeah. But that would really be helpful. And I'd love to show you the form we're using and see where you think you fit in or how we can do this. I would really appreciate that.
Terrific. Okay, sounds like a plan. Yeah, we'll definitely continue this. And our role partially here at LA Best Babies Network, you know, working with outreach in Welcome Baby, is to facilitate that and ensure that there is that collaboration and not the competition, and that people aren't stepping on each other's toes, that we're not sending all sorts of outreach folks from different programs to the same WIC office and so on.
Yes, because that's confusing.
Yeah, and I mean, I love that we continue, you know, maturing the idea and come to something that might be really feasible for our programs and yours. One of the things I do want to mention is that it might take us a little bit right now, because I am going to be center support, and I believe Sharon is too. So we've been told not to have access to email and to be completely out at the centers, and I am having a press conference next week, so I'm kind of overwhelmed with that too. So if you can give us maybe about 3-4 weeks before we retake, we can start emailing, and trying to get something organized. But the follow-up, I just want to say, don't feel that we're not following up. We're really physically unable to.
No, I know it's a very busy time for you right now.
Yeah,
sure.
But just to everybody, just tell people, okay? Tell people about the card. Yeah.
Definitely. I want to get to somebody who's had their hand raised here. I've noticed in the box, and that is Tina Wong from Emanate Health out in the West Covina, El Monte area she works in. So Tina, I'm going to unmute you, and feel free to chime in and ask your question or make your comment. Can you hear us, Tina?
Yes. Can you hear me?
Great.
No?
Yeah, gotcha.
Can you hear me?
Covina.
Yes,
Can you
coming
hear me?
through loud.
Yes, we hear you.
Okay. Sounds great about being able to collaborate and work together. And yes, the idea will be referring back and forth. We, as an outreach, when we do the intake, make sure one of our questions is if our clients or participants are receiving WIC, and then we make sure we inform them about all the new things and how they can do it, what office should they visit, and all that. But also, we need that support from WIC to be able to share or to guide, I will say, the recipients, and have in our mind, if we can share the idea about what can I do to better serve this participant or this client versus like, oh, this is too much paperwork for me. If we can just, focus on what can we do to serve or to guide this participant, I think we're on our way to do much better.
I think that's great input. We will keep that in mind as we work ways to collaborate and find out really. I mean, I think you really stated what the goal is.
And sometimes, Tina, thank you for your point. This is very good. But a lot of times, sometimes it's just the clients and their fatigue, and sometimes they don't want to fill out the information too, that we're trying to get them to help us with.
Yes. And I also want to add, yes, I'm sorry.
No, you go ahead.
Yes. Okay. Also, I wanted to add that I have a great relationship with the WIC that I visit. They're wonderful. They're very collaborative with me. They are very participant or client centered, which is that. No, this is in El Monte, the one in Santa Anita. They're really on top of things to be able to, like, what can we do better for clients? But unfortunately, I don't have the same support from the other clinic, which also is in South El Monte. And if we can just get a little bit more with the idea, again, that serving the participant better. And I know it's a lot of work. I know they do have a lot of paperwork. I know this is extra in a way, but it's just a matter of how we perceive and how we working for the community. And yes, it's a lot can be done, but I also am very pleased and very thankful for one of the clinics in El Monte. They were very close with me, with the Welcome Baby. They're a big supporter of Welcome Baby.
Well, thank you for the feedback, and I really cannot speak for the busyness or what, things might be going on that center, but I can definitely, this is great because it does help us. Where can we modify things maybe as we're doing it? I am thinking of some ideas I don't really want to share here yet, but I'm thinking because they're internal things that we can potentially do. But it's good to know where do we need to also work more with our centers. I think when they learned the benefit that they also receive from you referring, the extra punch to talk to clients about coming to WIC, people will do things for people that they trust. And we have heard that over and over and over, and that's one of the reasons we go to doctors' offices, we go to churches, we go to locations where people feel at schools, and your home visitation program is definitely one of them. And like I said, it will be really ideal and great if we put in perspective to the staff and the supervisor, if you put this effort, this is also the benefit that you get, because Pina is also going to be referring people or guiding them to you, and even potentially providing, more information on the resources. They might see it as a different. I think we might even need to, at one point, if it goes well everywhere, that some locations to be addressed individually if we need to, and see if we can look at that and see how we can better this.
Yes.
Yes, thank you. Thank you very much for your time. And just last one thing. I noticed that people that are referred, or clients that are referred from WIC to our site, they add, so that likely more to really trust and wanted to be enrolled in the program, because they're already coming with the trust that, okay, I'm receiving for WIC, I'm being benefited by WIC, now I can benefit by this program. So it does make an impact on the trust. And thank you for that.
Well, thank you. Yeah, thank you too.
Yes. And thank you for your time.
No, thank you, Pina. Yes, we really appreciate that.
Well, I see in the chat box we have a couple comments in response to my question about the potential for increasing referrals. We seem to have a pretty resounding affirmative on that one. So there is potential, I think, to do better. I think as Tina mentioned, we have a strong relationship with many WIC clinics, but you don't have to be better, right? We can build on that, we can improve, and
sure. Yeah, definitely.
Let's see, we have a question here. Antelope Valley from Christina says, the OS team in Antelope Valley Partners for Health refers based on fit for the mom and family. We refer to PFF, Nurse Family Partnership, Black Infant Health, HFA's expansion, CHVP, all home visitation in the Antelope Valley. Yeah, so I think this is in response to Sharon, your comment about the importance of including other home visitation programs and not just limiting it to Welcome Baby. I think the outreach specialists do a great job. It's even part of the protocol to refer out to, say, Nurse Family Partnership when possible, and now with the outreach, or with the expansion from Department of Public Health in LA County, they're working on referring to those programs as well. Some are even capped out now, so they're definitely not just looking for Welcome Baby clients, but looking to get families wherever the needs can be met.
That's very good. Yes. That's very good. And we really appreciate that, Steve, because I do think from what we can see, we have a lot of families that just are on the verge of a lot of things, and we rely on a home visitation program to kind of, because you have that time to really have those private conversations with them that we can see, and sometimes we can prevent people from, slipping all the way off, and so we really value that. And I think when we can look at these families comprehensively, because there was a grandma that, for example, that I would like to refer to your program that has no idea about it, who's recently had to take custody of the children. We a lot of times have to, our staff refers them to Child Protective Services, but I didn't see anything about home visitation. But I think really that's what the grandma needs now, because the child seems to have some developmental kinds of issues, and you just need people to help you figure things out, and that's the kind of thing I think we're trying to, and so like some of these other expansion programs, we haven't had access to them before. We were always referring them to the regional center, and this is great. Maybe they don't fit the Welcome Baby original model, but they fit somewhere with your partnership. Yeah.
Right. Yeah, and I think Welcome Baby and other all home visiting really provides great service directly, but one of the unsung benefits is really the connections that home visitors make with families to other resources in the community, and WIC obviously is a big one. So I think this is a perfect kind of partnership if we can build on this and even develop something formalized, an MOU with WIC and our programs. I think that's something that could be a big help. I wanted to mention that that's actually happening in Long Beach with St. Mary. The Families in Good Health program has an MOU established with the Long Beach Public Health Department. Long Beach has its own Department of Public Health. And unfortunately, Lindsay Gervasio, who is the manager there, is on a plane now and unable to tell us about that. But I did reach out to her and talk to her about that, and just wanted to let you know that there is that potential. We can formalize these relationships and really try to strengthen the referral process mutually. So more to come on that.
Yeah. Sure. That's awesome. That's great.
Steve, as a follow-up, as we wrap things up, we'll be able to circle back maybe in the next, by December, beginning of December. Is that too late, or
whenever you can? I know
before things.
I can't.
Yeah, I know with the rollout of the card and the app, it's a busy time for you all, so I want to be sensitive to that. But yeah, whatever we can do as fast as we can do it, I will do my best to not be the bottleneck.
Yeah.
And try to make those connections.
I like it, Steve.
Yeah.
And you know what? In the meantime, can you send us, because I think I need to refresh a little bit on Welcome Baby. It's been a while, but I think that one of the things that might be a disconnect even with our staff is that we don't know everybody, all the different names of the programs. Welcome Baby just all bleeds together. I know a couple of them that we work with, but when you named that one in Long Beach, we don't work with Long Beach, but it might be helpful for us to know all your agencies and programs, because maybe we have some familiarity with them through other ways. Yeah.
Totally right.
Yeah. It would help our staff. Yeah. So maybe we can share this with other programs as well, because I think we just need to know each other better.
Right, that's a big part of it. Sure, I think you're right about that. That goes to, I think Pina made the comment about staff meetings and outreach, and if we could have our outreach folks join those, if we can make some kind of arrangement for those meetings to happen and to include Welcome Baby outreach specialists and outreach folks from DPH expansion programs as well.
We could set something up.
Just let us know how we can do that. I'd be happy to try to help make those connections.
Okay, so Welcome Baby outreach, and
the outreach team from the WIC program.
Okay.
So we can put them together and they can both learn about their efforts.
Okay.
And then we can come up with a plan of how.
That's a good idea. Okay, we'll set something up.
Yeah.
It might not be until
I know.
January maybe, or somewhere after we kind of get that last rollout out. I'm sorry to say that, Steve, but that might be the reality.
It's just because being in the implementation team has to support the 3 waves, so that is taking us away quite a bit of time and lots of meetings and so forth. And I would not want to just not look at the things that we need to do if we plan something, but rather truly doing follow-up.
Sure, sure.
But let's keep
great.
talking.
Yes.
They'll send us the email.
Yes, absolutely.
Let's still do these
Yes.
things over email. And I want to welcome anybody that has any questions or anything as we're wrapping it up.
Yes.
To WIC, you can, Pina's
Yes.
our great contact here. Please call us anytime or whatever. We're open.
We'll be happy.
Yeah.
Yes, and Claudia's here nodding too. I mean, she can be your contact for Northeast Valley WIC.
Wonderful. Great. Does anyone else have comments they want to make, either in the chat box or get on the line and chime in? We welcome any comments or any thoughts or questions from outreach folks. Do the real work.
She reached out to us to participate.
Okay, go ahead.
Oh, sure.
Claudia has some announcements.
Claudia has a comment of an event. Go ahead, Claudia.
Hello, good morning, Steve. This is Claudia from Northeast Valley. We cover the San Fernando and Santa Clarita Valley. So I just want to make an announcement of an event that will be happening on December 4th. I believe it is going to be at Valley Presbyterian Hospital in the city of Van Nuys. Yamilet Guerra, she's actually the outreach specialist for Welcome Baby, that she reached out to me and she invited us. The event will happen between 10 in the morning to 2 p.m. in the afternoon. They are expecting about 100 people, but we're also promoting that event at the local WIC offices within the area.
Great. Great. Well, yeah, what was the date? I think Yamilet actually had mentioned that to me, and I think that is
December 4th.
December 4th. Okay, great.
4th, yes. Thank you.
Terrific. Thank you. Thank you very much. Yeah, thanks for helping. That's another great way, looking for referrals, but also help in promoting events like this for families, events that are run by some of the Welcome Baby and other home visiting programs. That's terrific. Any other questions or comments from anybody before we wrap up here? All right. Well, as Pina and everyone has mentioned, their contact information will be available. You can ask questions to them after this, and obviously send anything to me that you like, and I'll make sure to make the connections as well. And be on the lookout for a follow-up email with information, and we'll keep moving, and keep getting stronger together here. Thank you all very much for participating.
Thank you.
Thanks so much.
Thank you. Okay. Bye-bye.
Thanks for attending. Have a great rest of your day.
You too.
All right. Bye-bye.
Bye-bye.